That's me.
Hi, I'm Judy.
Hi, Judy.
Ow!
Careful, please.
Yes. How are ya?
Not good, the usual.
Oh, not good the usual, huh? Well, that doesn't sound good. Why is that?
There's a lot of things to talk about if we're going to start talking about my primary care, which I'd be happy to do, but, there's a lot of things.
Uh-huh.
Last time I was in, I was given a chart to go look for psychiatric help, and I told that person that, that it probably wasn't going to work, but I did everything. I was very diligent. I called every place, and I finally did get into a place, Rams, Richmond Area Multi-Services.
Mm-hmm.
And then when I went back, they told me that they couldn't provide psychiatric care because the psychiatrist only was there for the people that accepted medication. So I guess I need a referral to a psychiatrist. Also, I'm still throwing up and everything that I was last time. And last time they told me I had a throat infection and nobody took a culture for it, and I still feel like death warmed over. I'm now passing blood both ways. I was in bed for 6 whole days, just like my stomach was on constant fire.
Mm-hmm.
My stressors are still beyond all control, all measure.
And you haven't had any lab work done?
I haven't had any health care in 12 years.
Okay. So my concern is that you're bleeding, right?
Well, I don't know. Those last 2 days, there hasn't been anything, but for the prior 6 days, there had been.
Mm-hmm.
But I've also bled in the past, when I was sick, and, it would go away little by little, but I lay up in bed for in a cocoon from a long period of time.
Do you drink alcohol?
No.
No, okay.
I would sure love to start, though.
Well, that isn't going to help right now, that's for
Help?
sure.
I haven't had help in 12 years. I can't live on false hope.
No, I said if you started drinking right now, that wouldn't help.
Like I said, I haven't had help in 12 years. Having no help in the future, after not having any help, isn't a deterrent for me.
Mm-hmm. So how come you haven't come in sooner?
I've been looking for health care for 12 years and been constantly denied by the Department of Public Health, breaking the law. But who arrests if the Department of Public Health or somebody else breaks the law? Do you know the answer to that? You don't. You're shaking your head no. So if I am correct and they have broken the law, I can tell you the sheriff and the San Francisco Police Department won't arrest if they've been repeatedly denying me health care.
Mm-hmm. I'm here to help you today.
I'd love to believe that, but you know what? Unfortunately, after being put through the system so many times and abused, I have to be realistic and say I'll believe it when I see it. It's not a reflection of you, it's a reflection of all the concurring, non-stop harm that's been perpetuated upon me and damages by, a system that took an oath to do no harm.
So you've been vomiting for how many months?
I've been sick to my stomach for years now, and when it gets really stressful, it gets even worse. Like right now, the walls are really closing in. My depression is really kicking in.
I need to stay focused on one problem at a time. Can
I'm
you do
sorry.
that?
I'm trying.
Thank you. So the vomiting has been going on for years. Your stomach has been sick for many years. You've had bloody stool on and off and bloody vomit.
Right.
Okay. I got that. So I think that's one of your primary. Let's work on 3 very important problems for you today. Okay, we'll work on the blood and throwing up. We'll count that as 1. And then your sore throat, you said. And then what would you like to work on? Your psychiatric issue? Getting a referral? Okay.
A referral.
All right.
To a psychiatrist.
For depression, anxiety, so forth?
Well, so that the doctor can tell me if there's something that's wrong with me that I need to work on to get better, to want to have a life.
Okay.
Or for the doctor to look at me and say, well, no wonder you don't want to live. If I'd had that type of horrible existence, who would want to live?
Okay. All right. So
To basically, inform me that the failure has not been me looking for the care. It's been the fact that I've been repeatedly denied, and the system has allowed it. Just like, you know, the Boy Scouts, the
So
altar boys.
let me ask you some questions related to your depression or anxiety or whatever it may be. Are you having depressed mood every day?
Yes.
Yes. Are you having difficulty concentrating?
Yes.
Difficulty falling asleep?
Yes.
Difficulty staying awake?
Yes, I always close my eyes when I'm awake because it's relaxing.
Are you worrying a lot?
Every moment of my lousy existence.
Okay. Feelings of guilt?
No, I've done nothing wrong. I just live in the wrong place.
Okay.
An inhumane world.
Any hallucinations?
Define hallucination.
Do you see things that may or may not be there?
I see. You'd
That
have
you
to
know
make a
of.
you'd have to make a different because you know I see things that other people don't see, or maybe they see it, they just don't care.
Okay.
You know, people's inhumanity, one another. So when you say hallucination, who's really hallucinating? Is it me who sees everything, or
Okay,
everyone else who just turns the other way?
Because I'm not a psychiatrist, I can't get too deep into that.
Well, but that's why I'm asking you to define the word.
Loss of appetite?
Yes.
Are you feeling scared?
Yes. Panicky.
Okay. Racing thoughts?
I don't know what that means.
Okay, we'll move on.
I mean, if it means that there's a lot of thoughts going through my mind all at the same time, yes.
Okay. Thoughts of suicide and death?
You'd have to define suicide, you'd have to define death. I feel like I'm the living dead. You can't kill something that's already dead. I would have a life in heaven.
Do you want to end your own life?
You'd have to define life.
Okay, so I'll leave that to the psychiatrist.
I can define it. I can define existing, but I don't think I have a life.
All right. How about drugs? Are you using any drugs?
You know, medical marijuana for my depression and anxiety.
But nothing else?
Nope.
Okay. So I'm actually going to say no on your questionnaire here because I don't consider medical marijuana a drug.
Neither have I, but you know the federal government does. Doctor.
Now, you mentioned that someone said you had a throat infection.
Yes, the last nurse practitioner I saw, I don't remember her name. I may have written it down.
Did she treat you for that?
No. She had blonde hair, and unfortunately I made her cry, and I didn't mean to. I might have written down somewhere.
It looks like she gave you some Prilosec.
Yes.
Did you get that?
Yes. Did it help? No.
No. And how long did you take it for?
A week and a half. When it didn't do anything, I just said, well, hell with it.
Well, I'm going to suggest that we do some blood work on you.
That's great.
I think.
And I just want to say something for the record, since I record everything I do. Thank you, and I am grateful and I am happy. I'm just horrified and feel utterly betrayed that I would have to come and go through everything I've had to go through just to get basic primary care. Something I can't get through the Department of Public Health. I want to reiterate my total disgust. I'm thrilled that I'm finally getting what I should get, but I'm disgusted by the fact that the Department of Public Health has done this and can get away with it so long, and that nobody knows, and how many other people have been victimized. It just disgusts me. So
Jason,
I just have to say that.
Yeah. If you don't mind, I really want to spend my time and get your health care covered while you're here. I only have a certain amount of time for our visit, and I want to make sure I get everything done.
And while
as
I
much as
appreciate how
possible.
much you feel, realize that this is how I feel after 12 years of denial.
I understand
12 years of denial.
that. I understand that, but in order for me to be as effective as possible
That's
today,
fine. I agree and I
have
understand.
to stay focused.
And I'm focused on the 12 years of denial and the
I know.
continued denial that would happen if I hadn't been the one who continued to look for my health care and hadn't been betrayed by the
And I
Department of
would-
Public Health.
I would be angry too.
I'm beyond angry.
But let me
I am.
help you
Please.
now while you're
Thank
here.
you. Thank you from the bottom of my heart.
So here's what we'll do. Alright. So I'm gonna check your liver, your kidneys, white blood cell count to make sure you don't have some raging infection. I'm gonna go ahead and test your stool for blood. In terms of nausea, I'm gonna just treat the symptom for now until we figure out what it is. Sometimes there's an infection called H. pylori. It can make you very sick, can make you nauseous, vomiting, blood, cause ulcers, the whole 9 yards. We'll test you for that. I would also like to test you for everything under the sun, from STDs to whatever. It's just a pan labs.
That's
Okay.
fine with me.
All right. And so we'll say, so the pain in your stomach, is it really pain, or is it just nausea, or is it?
It's different on different days. Some days it's like I want to throw up and it's painful. Other days it's like it's on fire,
Okay.
a burning sensation, and it's not just my stomach. It's up at the top. It's down at the bottom.
Okay.
It's throughout the entire thing, and then there's strange noises at times. All
Okay.
and sometimes in the past, like depending on how stressed out I get, it affects the firmness. I know this is going to sound really funny. Of
That's
my
okay.
stools.
That's fine. I want to hear whatever.
The more
description
stressed
you
out I
have.
get, the more runny it becomes, I guess. I don't know. I try to keep it together mentally just to,
Okay.
but when it gets to be too much, like I said, I just cocoon myself away. And unfortunately, since I don't have housing help, I don't have food help, I don't have anything, you can just imagine the downward spiral. And then I'm fighting, of course, the Department of Public Health, which is breaking federal medical law, but humanity doesn't matter on this earth.
Right.
It's not right, but I understand what you're saying.
Okay. Have you ever, before 12 years ago, when you were able to see a provider, were you diagnosed with any illnesses then? Did you have
Yes, I have what's known as an adjustment disorder. My previous provider, healthcare provider, is Mitchell Katz, the director of public health. Mitchell Katz abandoned me the day that I turned around and sued the city because my soulmate had died, and I went to San Francisco General in psychiatric emergency, and they denied me emergency care. So I sued the city. The doctor abandoned me to add more stress into my life, so I wouldn't sue the city. The city committed fraud and testified in court to have my case dismissed, and 4 years later, through the Office of Inspector General in Washington, D.C., signed a confession admitting it had broken federal medical law.
Come and sit here.
Shall I continue to tell you the abuse that I've had? Yes.
Can you open your cup for me? I want to listen to your heart. Just breathe normal.
So up until then, I had a doctor for...
Wait.
I'm sorry.
Take a nice deep breath in and out. Again. One more time. Good. I'm just going to gonna feel your neck for lymph nodes, okay?
More tender and it's more so up here.
Up here.
Yeah, well, then again, like I told you, the nurse last time, it's like my sinus on this side is always stopped up and it smells. It smells foul. It's been smelling foul for a while.
How long?
Months.
Okay. Open your mouth. Stick out your tongue. Say ah.
Ah.
Alright. Lift up your tongue. Okay. Alright. And it's been smelling foul on the left side, you said?
Yeah.
I'm gonna take a look if you don't mind. Head up and then hold still. Have you ever had a sinus infection?
Years ago,
Okay.
no, I had this pain up here, and somebody told me it was sinus, and I took sinus medicine, and it went away, and that's the first and only time I'd ever had one, and then
Okay.
I'm beginning to feel it's the same thing,
Alright.
similar.
Let me look in here. Okay. You may have a little sinus infection up a little higher. I'm not seeing it here. But, you know, nevertheless, your symptoms are describing
Right,
a
right.
sinus
And it'll blow, and it'll be wind out of one side and smell out of the other, and it's always smelly. It's,
Okay.
it's yellowish. I'm not used to it being yellowish, greenish. I'm like,
Well,
what?
I'm going to probably just treat you with an antibiotic anyway, because you may have a little infection in your mouth as well.
Oh, great.
Look straight ahead and focus on one particular spot. I want to look in your eyes, okay?
Sorry.
It's okay. Okay. Do you have problems reading small things? Small print? Yeah.
And, you know, if the light changes, you know,
Okay.
like, you know, watching TV, you know, if the light changes, it has to do with, I guess, contrast. I don't know.
Mm-hmm. Just relax. I know. But I want to check your reflexes.
No, but I'm just saying, the thought of just relaxing.
I know. Your heart sounds good. Okay, let's get that lab work. And I'm going to write a prescription for you for an antibiotic. Do you know if you have any antibiotic allergies?
Not that I know of. Where do I go and get my prescription filled?
At the pharmacy at General Hospital.
I don't know if I can go there.
Okay, that's where our pharmacy is.
So what does that mean then?
It just means that you would try to get there if you can for antibiotics. I'll tell you
Let
something.
me be honest with you.
Yeah.
Please. On video. 9/18, I was illegally 5150'd to General Hospital. I was released within 2 hours because it was an illegal 5150. General Hospital is where I was denied emergency care.
Okay.
You know, which is also the place that basically signed a confession and left me for dead. I feel. I went and I asked for my medical records. I was denied. I was intimidated by being told they were going to call security for my illegal 5150.
Okay.
I really feel that, you know, psychologically, I can't deal with San Francisco General because they're not accountable. They could kill me and not be accountable. And they have already in the past by signing a confession and leaving me for dead. You know.
I'll tell you, I can write a prescription for you, but being that you say you don't have any money,
Correct.
is there someone that can maybe help? You know, I can't suggest anything. Other than,
Honestly, doctor,
Is
nurse
it allowable
practitioner.
for another person to go in and get the medicine for him?
so
Anyway,
that,
you know,
that I'm not sure of exactly.
you know,
Possibly yes.
Okay.
Possibly yes.
I want to stay away from San Francisco General as much as I possibly can because all they do is victimize you. And unfortunately, you know, it's not. You wouldn't send a kid back to the priest that molested him. It's not
No,
really
but
my
I don't
problem.
have any control over where
You know,
you get your
compartmentalized
free
responsibility
prescriptions,
is
you know?
not my problem, Doc.
Well, if I can go in and get it for you, then
That's fine.
Absolutely. Maybe he can, you know.
You know, but you know.
So let me put in your lab orders, okay?
Please.
and my nurse will come in and get you through
Please.
those, okay? And I'll have him also schedule a follow-up so that we can go over all of your tests.
That would be great,
okay?
and let's not
Are you
forget
taking
about the
blood
referral
samples
for the,
usually?
I will write the referral for psych, okay?
thank you.
All
And
right.
1,000 camels walk your way in a desert.
Wow. I'm sorry, I didn't catch your name.
I'm Dan McFadden.
Dan, hi. So,
Um,
nice to meet you both.
so will he be getting blood samples? for the
Yes,
test?
he will. Yes, he will. And he'll be taking some cards home for a stool sample as well.
Oh, okay, yeah, yeah.
And I also would like to get a stool sample for, so I'm testing you for a lot of things, basically. I'd also like a stool sample to test you for certain types of infection in the stool. Okay, so. all right.
I mean, I don't,
Yeah, it's common.
Yeah.
They do. Remember, I've been hounding you to get a blood sample for years.
I'm not, did you hear me disagree with anything?
No,
Did you hear me lie about anything?
No.
Did you hear me not point out what the truth was about everything? Yeah. You know,